you're pregnant and you see blood and your heart sinks. Bleeding during pregnancy is one of the most frightening experiences, but it is quite common actually. So 1 in 4 pregnancies will experience some bleeding. I'm Zainab, I'm the pharmacist from PillSorted, and I'm going to explain what causes the bleeding in early pregnancy, what is miscarriage, and what are the things that we assess and you need to look out for. Bleeding in early pregnancy can happen for several reasons. Some of the reasons for early bleeding in pregnancy is quite harmless. For example, the implantation bleeding. That's when the embryo is trying to stick, and sometimes it can cause a little bit of light spotting. The other thing is, because there is more blood flow during this time in the cervix, that can cause a little bit of light spotting as well. These two are harmless. Sometimes they're caused by infection, and that's quite manageable as well. But there's 2 serious reasons that can cause bleeding. One of them is miscarriage, which means the pregnancy stops before week 24, and the other one is the ectopic pregnancies. That means the embryo or the baby is taking shape outside of the uterus. But the important thing is, if you have any spot bleeding, you do definitely need to get it checked. When you come, these are the questions that are going to be asked from you. So first of all, how much is the blood? So was it the size of a penny? Was it the size of a 50 pence? Is it more than that? What color is the bleeding? Is it brown or is it bright red? And how often have you seen the bleeding? So all of these will help us assess what stage you are, what might be the problems behind it. The other things that we'll assess is a blood test to make sure how much is your HCG level. So HCG is the hormone that we talked about that'll go quite high at the early pregnancy, giving the signal to your whole body to say I'm pregnant, and usually it keeps on rising. But when we do blood tests within 48-hour time period, if the amount of HCG has gone down, that usually shows that the pregnancy has stopped. So that's one of the things that we look at. Plus, there might be other tests like the urine to see if there's infections. There might be a scan as well. So if it's before week 8, we might have a transvaginal scan. It can be a little bit uncomfortable, but it's the best way to realize what's happening. I'm going to talk about the more serious reasons that might be behind the bleeding. So the one that I want to talk about most today is about miscarriage, because it is common. 1 in 8 pregnancies end up as a miscarriage. Now, why does miscarriage happen? This is really important. Majority of the time, so more than 90% of the time, miscarriages happen because there's a chromosome dysfunction in the baby. So what's a chromosome? It's a really compact, coiled set of information. That's the DNA, and that transfers information in each and every cell of the baby. So if there's a malfunction there, the baby doesn't have a chance to survive. So the pregnancy is not going to work right. So it's your body's mechanism of defending you. That means it's not your fault. There's nothing that you could have done that brings the miscarriage on. There's nothing that you could have done to prevent it to happen either. So that means no amount of hard work, lifting heavy things, eating strange stuff, stress on you could have caused the miscarriage. This is really, really important to remember. And the other important thing about miscarriage is they're usually one-offs. So if someone has had a miscarriage experience, it doesn't mean that they won't be able to have another successful pregnancy. Now, I want to talk about the other serious reason that bleeding might happen, and that's called the ectopic pregnancy. So the ectopic pregnancy is when the fertilized egg gets implanted outside of the womb. So if you remember about the female reproductive organs, there's the 2 ovaries that release the egg. The eggs come down the fallopian tube and they need to get implanted when they're fertilized in the womb or the uterus. Now, if the implantation happens in the fallopian tubes instead, this is very dangerous. Only 1 out of 90 pregnancies end up in ectopic, but they are risky for the mother. So what are the signs of an ectopic pregnancy? One of them, as we talked, is the vaginal bleeding. The other one is pain. So there can be a sharp pain on one side of your tummy. The other pain that is quite distinct is actually the shoulder tip pain. So how that happens is the diaphragm, which is a dome-shaped muscle, it separates the stomach area from the respiratory area. And if the fallopian tube ruptures, it causes bleeding, and that bleeding brings pressure on the diaphragm. And The diaphragm shares the same nerve with the shoulder tip. So instead of showing painful in your tummy area or the diaphragm, it'll show as shoulder tip pain. And the other thing is feeling really dizzy or not well. Any of these symptoms definitely needs to be checked, and it cannot continue. How we usually deal with an ectopic pregnancy is it has full-on monitoring. It needs to have medication to terminate the pregnancy, or if there's any complication, it gets monitored. Again, the good thing about an ectopic pregnancy is they're usually one-off. It's very rare for women to have 2 ectopic pregnancies, and you can go on and have a successful pregnancy even with 1 fallopian tube. I want to share my own experience with miscarriage, and I want to point out the things that are really important. I had 2 successful pregnancies and 2 healthy, beautiful babies. My 3rd pregnancy ended up as a miscarriage, and I remember the day that I was just going about my day. I just told my family and friends that I'm pregnant, and I just saw a very tiny spot bleeding, and I really didn't think about it anything. But then in an hour I saw there's another one, so I thought I'd better get this checked. So as soon as I called, I was surprised that they said come in, because they usually say wait it out or whatever, but they said no, come in. So I went and they did the blood test and all of that. It really was in a matter of hours that I was told this is a miscarriage. The biggest thing for me on top of the loss was the surprise that this is so common. I remember the first question that I asked the consultant was there anything that I could have done different? And she came back to me and explained really well that this is so common. 1 out of 9 pregnancies happen like this, and it's because of the chromosomal malfunction in the baby. So there's nothing that I could have done. And I think this is really important to repeat and reiterate. A lot of us feel this loss and we feel guilty about it. There's a lot of grief, there's a lot of hurt, and a lot of feeling upset and guilty about it. But there genuinely isn't anything that you could have done to stop this. So again, there's no heavy lifting, eating differently, working full-time. None of these would have made any difference if a miscarriage was meant to be. It's your body defending yourself. The third thing that was quite reassuring for me was actually miscarriages are one-offs. It really doesn't mean that you're not going to be able to have another baby. Just like in my own experience, I did went up to have a 4th pregnancy and happy, healthy baby. So it's really important to share this heart-breaking experience and talk about it and find the right support. So what happens during and after a miscarriage? When you realize the miscarriage has happened, they'll give you different options. One of them is to wait it out naturally. So you will have a lot of bleeding and you will have sort of a hormonal crash, just like once you have after labor. There are other options like that you can be offered medication, so that'll help expedite this, or you might need surgery. But the gynecology team, the midwives, they're really experienced. They know how to help you the best. What are the things that you need to look out for? So any bleeding, definitely get it checked. If you have heavy bleeding, if you feel dizzy, if you have pain, especially in your shoulders, those are the times that are urgent and you need to go up to emergency services straight away. As a recap, bleeding in early pregnancy is frightening, but a couple of them are serious, so make sure you get checked. And more important than that is there is a huge amount of support out there, so please don't go through it alone. Reach out to your healthcare professionals, to the gynecology team, and there are fantastic support groups out there from people who've been there, had to experience this, so you don't feel isolated and frightened about the difficult circumstances. This video is part of our pregnancy series videos. Visit our website and reach out to us for that clinician-led safe advice. Thank you.